The government confirmed its first COVID-19 patient on the 21st of March 2020. Immediately after the announcement, government closed schools, worship centers, followed by a total lockdown in a bid to stop the spread of the deadly virus, which was spreading like a wildfire across the world. At the time, Laura Nagasha, like most of the first positive cases, had traveled through Dubai. On her return, Nagasha was invited by the health ministry to go for a COVID-19 test. For a while, she was not given her results, but with time, Nagasha finally realized she had tested positive.
So at the time, people were really scared. So some of the people that they would find positive would run away. So they were not directly telling the people their results. They would tell like someone that you're with.
At the time when you heard that the ambulance is coming for you, what came into your mind?
It was very scary because that is when it hit me that, wait, these people are not joking.
After surviving the COVID-19 battle and was discharged, she had another problem to deal with: stigma.
The entire community was still hostile. Even where I was living at the time, I don't think it mattered that I had a negative test. They still looked at me as a COVID patient. So there was, we had little information. We only knew what we were seeing on television, death. So there was just a hostile environment.
How did you get along with friends?
Because it was a revelation, sort of true friends and people that are gonna be with you when things are tight. And also, it was also a revelation of some of the others. What I had to learn was not just to forgive, but also to sieve out some.
So when you heard that people are dying in Uganda, and you're one of the people who survived this deadly disease or virus, how did you get to terms with that?
When it started to affect members of my family, like cousins, aunties and uncles, and just people that were really close to home, and you're hearing that they're actually in ICU or they're hospitalized at a time where you can even self-quarantine at home. That was when COVID really hit hard for me.
After all this, and then you resumed work after government opened businesses, especially restaurants. Did you immediately open your restaurant?
I have to deal with, are people going to be okay with eating food from a business of someone that got COVID? Is that going to be? So even after they opened for restaurants to open, I genuinely stayed closed.
Now that the vaccine is here, do you feel like you should have been one of the first people to get this vaccine?
Personally, I feel healthy. So I think that, like, genuinely the most vulnerable people in our country, like the elderly, the essential workers, all those people that are at the front line, in the hospitals that are always exposed, I definitely believe those are the people that should get and maybe teachers, because I mean, parents are really anxious. They want kids to go back to school. So I think also teachers should be vaccinated at this rate.
Today, Laura Nagasha can look back with hope, being among the first patients to survive COVID-19. But she cannot forget what being part of the statistic of patients meant. Sudhir Biarhanga, NTV.